Hello and welcome back to A Slightly Twisted Female. I am your host, Brittany Today we are going to be discussing Lupron and the effects of this drug in children used as a puberty blocker as part of a transgender healthcare regimen, which has been touted by trans rights activists as being essential healthcare for gender nonconforming, gender confused children. As many of you has probably heard, a lot of trans rights activists tout this as a totally reversible, sort of benign way to put a quote pause on puberty. We have records of healthcare professionals, of proponents of this sort of anti-hormonal therapy, that it's reversible, it has no lasting damage. And we're just going to take a look at the validity of a lot of those claims and take a look at this drug Lupron. So taking a look at the history of Lupron is originally developed to be a gonadal hormonal antagonist, which means that it stops hormone production, and it is used for male prostate cancer. It is meant to stop testosterone production. As we know, a lot of cancers are related to sex hormones, gonadotropins, such, testosterone and estrogens. And so additionally, Lupron has also been used in addition to prostate cancer, and severe sort of end-stage prostate cancer in men. It is also used as a treatment for severe endometriosis for women, in which the endometrial lining in women's uteruses grow outside of the uterine space, and it is incredibly painful. It can inhibit fertility, and the pain can become so great that it impedes women's ability to just function on a day-to-day. So it's understandable why they were looking at different treatment options, and because it does block the production of sex hormones, they look to this as a treatment option. What we also know is that Lupron has to date had the most expensive, largest payout for a medical malpractice suit of any drug in any one singular suit to date. And, so fast forward a few years later, we have the transgender movement, and they said, hey, let's sign these kids right on up. We don't have any long-term studies as to the health, safety, or efficacy of using this drug in children, but no big deal. We have a few examples of using this drug for precocious puberty, so it must be fine for any child who is gender confused, who has signs of mental illness, body dysmorphia, and this is now being prescribed as sort of a routine standard of care for trans healthcare. And this is the healthcare that they're telling you that if kids don't have access to, that their lives are in danger, their quality of life is going to plummet. So let's take a look at that. All right, so I wanted you guys to look at, first, let's take a look at some complaints that women have documented of their experience with Lupron from an endometrial vantage point here. And we're also going to go through, there are 25,000 citations of adverse effects that have been recorded related to the use of Lupron since its approval by the FDA. And just as a reminder, the FDA does not fund and conduct its own studies, which is, so clearly a flaw in its, function as a safety, I mean, as a safety standard to, approve or disqualify new drugs and therapies to be put on the market for consumption by human beings, and for use by healthcare professionals to apply to human beings. So if they're not funding and creating the studies, then who is? Well, you're probably thinking, well, definitely couldn't be the actual manufacturers of the drug. That's obviously a conflict of interest and it makes no sense. And if you thought that, you're correct. However, that's exactly who they rely on to get the studies. The FDA relies on the drug manufacturers themselves to provide studies. And if they feel like studies enough, I mean, it's so insane and counterintuitive. Anytime a study is released and even when scientists have to speak on something, they must disclose their conflicts of interest. So the fact that this isn't common knowledge, that the FDA relies on drug companies self-reporting of drug trials and safety tests, it's really like a dystopian nightmare. So anyway, welcome. All right, let's take a look. All right, we are going to start with, let's see. All right, we're going to start with this one. So let me get this. All right. Women speak out about highly controversial drug injection. And again, this is Lupron. This is women who were prescribed Lupron for endometriosis and endometrial problems.
Are speaking out against a highly controversial Several women are speaking out against a highly controversial medication for endometriosis. They say it can have serious, long-lasting side effects.
7 investigator Heather Catallo is here now with a look at this and with the response from the drug maker. Heather.
Some people who take Lupron have complained of severe bone loss, fatigue, headaches, depression, hot flashes, and more. A lot of patients say their doctors did not give them enough warning about how dangerous they say this drug can be.
It was such a dark place for me. If you would ask me if I would do Lupron again, absolutely not. That's like playing Russian roulette with my health.
All these women say they've been affected by a highly toxic drug injection called Lupron. It was originally developed to chemically castrate men dying from prostate cancer.
Okay, so it was developed to chemically castrate men dying of prostate cancer. Some of these cancers are fed by, sex hormones, right? So testosterone, estrogen can feed cancers. And knowing that, we also know that exogenous hormones, such as, even women who are at a risk for breast cancer, are routinely advised not to take hormonal birth control because that can feed a cancer. So if we're taking an entire population of children for whom, these cancers take years and years and years to develop, right? And to present themselves. And we're taking a population of children and we are giving them exogenous cross-sex hormones, these sex hormones, these synthetic estrogens, synthetic testosterones. And we know that long-term use of these, hormones can lead to and exacerbate cancer. So we can expect that as Lupron becomes more widespread and as the exogenous use of testosterone and estrogens in, cross-sex use becomes more widespread, we are going to see a tidal wave of cancer cases as this population ages. Mark my words. It's scary. I don't know where we're going to be at that time, what sort of, the health resources that this is going to take. This is the long-term consequences are already setting themselves up to be so obviously catastrophic, widespread, and entirely predictable. And yet we're marching forward anyway. We're demanding more access. We're demanding that Medicaid cover these. These are turning children into lifelong medical patients, and they are going to be hit with problem after problem after problem in their health. And again, and as a reminder, this is, in cases of, end stage cancer, stage 4 cancer, aggressive stage 3 cancers, there is a cost benefit analysis that must happen. What is the cost of taking these drugs versus the benefit of taking them, right? But when it comes to gender dysphoric children, we are taking physically healthy children with healthy, functional bodies, and we are administering a physical response and a biological remedy for a psychosocial problem, for a psychiatric illness. Hold for 1 second. I'm going to pause the stream just for 1 second.
Clinical studies show it can be an effective treatment, but these women say the risks outweigh the benefits, risks that they believe their doctors downplayed.
I was told that it would just be a brief time of temporary menopause and that I would have hot flashes.
Terry Paulson was out.
That sounds really familiar, doesn't it? It sounds really familiar that, it's just temporary. These are just mild, sort of superficial side effects. Nothing to worry about. Your body will adjust as soon as you end the treatment. And as we're going to see too with another video, a doctor is explaining to men that the side effects that they're going to experience are temporary once you end the treatment, but then goes on to explain how many of them are actually not temporary. But yet, puberty blockers are totally reversible, correct? Right. No, not at all. And let's keep finding out.
Going and active before taking it for her endometriosis. Now she has full-blown osteoporosis.
What happened was her immune system started eating her own bones.
Dr. Alan Levin is an immunologist and an attorney. He's helping Paulson sue the drug makers, claiming at the time she was given Lupron, the prescribing information did not adequately warn of the risks of significant permanent bone density loss.
And it is so important to remember that as children are developing and their bones are developing, we know that this impacts the osteoblasts. Osteoblasts are the things that create bone, and bone is a living tissue. And, we're going to have children with skeletal muscular deformities, and as they're pushing to administer kids younger and younger, we're starting, right now, in the United States, they say kids as young as 8. I don't know how hard of a cutoff that is, because they also said that, young children weren't being given double mastectomies. However, we've had undercover reporters such as Alex Aheron from Gender Mapper that expose that there are children's clinics, gender clinics, that are giving double mastectomies to children as young as 12 and 13. I can't... the breast tissue isn't even fully developed at that time, let alone the prefrontal cortex that is in charge of, executive function and long-term decision-making and planning. The fact that we're doing this to kids, it's so unconscionable to me. And so again, these kids are going to have deformities. There's kids that aren't going to grow as tall as they should. The skeleton is essential to anything that we do, whether it's sports. They're talking about trans kids in sports, yet you're retarding the skeletal growth of these children, and these kids are going to be at risk for severe fractures. We know people die from things like a hip break. Your skull is also part of your skeleton. What if one of these kids falls on a bike? Falls the wrong way on a bike and shatters their skull? Or what about the spine that houses your spinal cord? We're setting kids up for very serious injuries, crippling situations, crippling conditions, but yet they're telling us that it's reversible. Tell me how, during these windows and stages of growth, when osteoblast production is critical, how are we going to be able to reverse that? Please explain, because so far I haven't seen any logical or coherent explanation of how that is reversible, because there is none.
The label warns that thinning of the bones may occur, which may not be completely reversible in some patients.
Okay, and to be clear, this was 3 years ago. This has been, this Lupron issue has been going on for the past decade. So we know that these issues are irreversible. The drug manufacturer themselves has it listed on the label. The thinning of the bones may occur during therapy with Lupron depot, which may not be completely reversible. So the drug manufacturer itself has said that. And then let's just take a look really quick at what these trans rights, let's see.
Reviewed studies and required that the label drop this statement. For a period up to 6 months, this bone loss should not be clinically significant.
The problem with Lupron is not that the drug is bad, it's the manner in which it's given.
Dr. Levin says physicians need to tailor the amount of each dosage to each person. Drug maker AbbVie sent us a statement reading in part, safety information for Lupron is well documented in the prescribing information. AbbVie regularly monitors and reports to appropriate regulatory agencies new safety information on an ongoing basis to ensure that our label contains accurate and
So it's ridiculous, and they're constantly changing. It is clinically significant. And again, this is in adults. These are in, adults who are musculoskeletally fully developed. Okay, we're talking about the administration of this drug in children who haven't even reached puberty. Not even, we're not even talking about, like older teenagers who at least are nearing, full grown adulthood. We're talking about children who, an 8-year-old whose voice hasn't even changed. These are young children. I had a friend, his twin brother grew a foot in college. We know that a lot of men and boys, young, boys and teenage boys have these late, growth spurts and whatnot. It's, all right, let's take a look. It's so upsetting. Oh, hold on. I just pulled this out by accident. All right, so I want to take a look at, this is a physician talking about the side effects in men who use it for prostate cancer. And again, this is with a cost-benefit analysis for men whose lives are being threatened by an aggressive cancer. Okay, this isn't a psychiatric illness with a healthy body, like in the case of trans-identifying children or trans kids, right? These are people with clinically definable, measurable, reportable evidence of bodily disease, right? Cancer is something that you can measure and show. What blood test is there for gender dysphoria? What kind of clinical studies are there for gender dysphoria? Where can we point to, we have a positive test for gender dysphoria, and we're giving them these chemotherapies. And one thing I want to say about treatments for cancer, why, if it sounds extreme, it should. Why? Because it is. Cancer is an anomaly of the human cell, right? It is basically a normal cell that got damaged. And as you know, cellular reproduction is it's asexual, right? A cell, it copies its own DNA and it splits. If that cell is damaged, right? And if it's like a free radical, if that cell is damaged, when it splits to create a child cell, that cell is going to be reproduced identically in the image of the parent cell. which means it too will be damaged. And then those split again. So now those 4 cells are damaged, and then those 8 cells are damaged, and then those 16 cells are damaged. And that's how cancer happens. It is a damaged cell, a human cell that is very, very similar to a healthy cell, correct? So what makes it so difficult to treat and get a hold over cancer is because of how similar the disease is to healthy tissues and cells. When it's something like a virus or some sort of bacterial or infection, those organisms are so different from our body's cells that we can create therapies that target those things and then can see them, and it likely won't have an effect on our healthy normal cells, right? Because it's so structurally different, like a virus or a bacteria. But when you have to create therapies for something that is so structurally similar to our healthy cells, things that are toxic to the cancer cells are very likely going to be toxic to our healthy cells. There is a small margin, a therapeutic margin in which we can attack cancer, because the reason why we can attack cancer without totally killing off all of our healthy cells and destroying our organ function and the function of the rest of our body is in the one small fact that cancer cells and damaged cells are slightly less stable than healthy cells. It's a small margin and you have to get into it. Healthy cells are still going to be affected, but for by and large, if you're healthy enough and if there aren't that many cancerous cells, you can safely treat yourself, but you're still going to have a lot of impacts on your healthy cells. I know. When I went through cancer treatment, so much of what makes you feel the worst is the treatment itself. It's not even necessarily the cancer, because the treatments are toxic to the cells that are so similar to your healthy cells, so it is toxic to the rest of your body as well. You just are slightly more resilient with the healthy ones. And if and that's why it gets so hard that once cancer has spread so much and it started to take over such a large percentage of your body and you're having to treat it with so much toxicity, then you start to toxify the entire body. And then, that's when the body really does start to shut down. That's why a lot of these treatments, you can only do them once. Radiation therapy, literally taking radioactive waves and destroying the cancer cell, only works because the cancer cells, the damaged cells, are slightly less stable than the healthy cells. But you can only rate an area once because those healthy cells are still being harmed. They're still being damaged. Many of them are still dying off. Luckily, not all of them. So the ones that remain can then, reproduce, and you can get back up to speed with healthy cells. However, you can't keep doing it because now that area is so fragile. You will actually begin to destroy the area if you overexpose a healthy area to radiation. So I say all of that to say that if this works against cancer, then we can almost be sure that it is going to have serious impacts on the rest of the body.
Hi, I'm Dr. Scholes. Let's talk about prostate cancer. In today's video, we're going to cover how to reduce the side effects of hormonal therapy when it's used for the treatment of prostate cancer. Hormonal therapy has a variety of different names: androgen deprivation therapy, ADT for short, testosterone inactivating pharmaceuticals, TIP for short. Hormonal blockade comes in various forms and various intensities. We're not going to try and emphasize that very much in this video. We're going to focus primarily on the common medicines that are called hormone blockade are the injections such as Lupron, Trelstar, hormone blockade such as Extend, what is required for the treatment of. The number one problem is loss of muscle and besetting fatigue.
Oh, hold on. Wait.
One problem is Let me start by saying that the number one issue with hormonal blockade is not loss of libido. Loss of libido is reversible. The number one problem is loss of muscle and besetting fatigue.
So he says that libido, the loss of libido is reversible. And what we know, and we are pretty sure that even in women, libido, sex drive, and sexual desire comes from testosterone. That's why that even as you, and actually as women's estrogen begins to decline as they enter a sort of perimenopausal stage, usually starting on average at about age 47. It takes about 7 years. And you know, it usually ends somewhere in the mid 50s, right? At which point the woman is, you know, fully in menopause, in which there is no more estrogen production. But a lot of women in their mid to later 40s find themselves going through a time where they have an increased sex drive. And people always say that women in their 40s sort of hit their sexual peak. And the reason for this is that as estrogens start to decline in the system, there is proportionately higher amounts of testosterone in the system. So that works on the body and translates to a higher sex drive. Now, there's other issues that happen with the lower estrogen, such as lower self-lubrication, you know, and other things related to sexual functioning. There can be, you know, vaginal stenosis, a shortening of the vagina, a loss in pliability of the tissues. But the desire for sex is still, you know, actually women experience it as an increase, a surge. And again, like I said, it's because it's proportionally testosterone is higher in the woman's system, because even women produce testosterone, obviously in much lower amounts than men naturally. So if testosterone is related to sex drive, right? And if, you know, and he's saying that it's reversible. Well, we're talking about people who went through a normal puberty, who, you know, experienced full sexual function, and whose bodies were given time to fully develop sexually, and that their hormones were able to reach sort of a homeostasis, a good, you know, just functionality. But we're talking about how reversible is it then? If we are administering this in children who have not even had the opportunity to gonadally function, their gonads have not fully functioned, they haven't even started working yet. You know, we look at puberty in a few different stages. There's Tanner stage 1, Tanner stage 2, Tanner stage 3, and this all is defined by which changes in the body have taken place. Tanner stage 0 is when puberty has taken place in the body. And so if we are giving this to children at Tanner stage 0, Tanner stage 1, even Tanner stage 2, the child has not had an ability to develop gonadally. How can we say that it's reversible? Right? If we're suppressing their body's ability to function and develop, we know there are case studies of young men who have the penis development and penile development of 9-year-old boys because of having been pubertally suppressed, right? We know that, you know, men like Jazz Jennings will never ever experience an orgasm, something that his lead surgeon, Marcy Bowers, admitted in a paper. That he believes that no, given, I think he said, if anyone who is given Lupron or is pubertally suppressed at Tanner stage 2 or earlier, he believes that not one has ever, you know, that we know of, achieved orgasm, nor will they ever. And yet he's still performing this on children. He's still advocating this. He's still pushing for it. So if this does this to adult men who have already been fully formed, we imagine what this is doing to children who have never formed properly sexually. And sex, like, my God, we have such like a perverse, insane relationship with sex in this country. It's like we treat it in this, I mean, even in this just culture, this Western world, where it's like we see it as like, oh, it's something we shouldn't know, it's bad and it's wrong, but we're also so obsessed with it at the same time. But it's like, at the end of the day, sex is a normal, healthy, wholesome part of an adult life and an experience. It's a way to physically express your affection for somebody. It's a way to connect with your own body. I mean, these people can't even masturbate. I mean, I even think about people like Shapeshifter can't even masturbate. It can't express that sort of bond with another person. Imagine what is lost. Hold on for 1 second. I gotta pause this for 1 second. Okay, let's take a look.
Tiredness that you just can't believe. The important thing to know about this
Okay, so he said the most notable side effect, and I mean, I don't know, is
fatigue.
Is loss of muscle and fatigue. And again, he's talking about adult men. A lot of these men who are older, a lot of these prostate cancers develop men middle age and onwards, right? So these are men who have already fully formed, who are already working with a full deck of cards before they got ill. We're not talking about 8-year-old little boys whose voices haven't even changed yet. So he's talking about fatigue, okay? And again, imagine when we're doing this to children who already have so much on their plate. And we know, anybody who has a child who is growing, we know how exhausting it is to go through growth spurts, how tired kids get. We know that children need so much more sleep than adults do. As kids get older, they progressively need less sleep. We know that, babies sleep up to 20 hours, newborns sleep up to 20 hours a day. It slowly goes down. Then it's like 18 hours. And then, a child, a toddler, a preschooler needs, somewhere between 10 and 12 hours of sleep a night. Even kids up to the age of 10 need somewhere like between 10 hours of sleep. These kids are already exhausted. They're already have so many obstacles with the amount of growth and development. And that's because their body is growing so rapidly. It's because so many changes are happening. It's because they're growing intellectually, they're growing physically. It's exhausting. So we're going to throw another roadblock where now they have to deal with extreme fatigue and exhaustion. And again, a lot of these are mentally ill children. These are neurodivergent children. These are kids with other sorts of psychiatric disorders, autism, things like that, who already feel uncomfortable in their body. And we're going to be like, all right, let's make you, way more uncomfortable physically on top of it.
Tiredness that you just can't believe. The important thing to know about this loss of muscle and tiredness is that it's very treatable. It's one of the most treatable side effects. If men will commit to doing weight training, lifting weights 2 or 3 times a week for 30 to 45 minutes, they can maintain and sometimes even build muscle mass and retain the sense of normalcy that they've always had.
Okay, so what about an 8-year-old? What about, what is your name? Let's see, PCRI's Executive Director, Mark Schultz. All right, Mark Schultz. So what about an 8-year-old? Should an 8-year-old be excused from, what grade would they be in? 3rd grade to go do what, weight training? Should they go bench press? What about for children? Now, and I know that that's not what he's his topic, and this is why it's important to look at how these drugs are treated when we're talking about in other contexts, right? Because that's going to give us more answers. There's not going to be the political filter when we're looking at it in the context of children. I had, God, who was it talking about? There was this one detransitioner on TikTok who was saying that whenever she would go in for some of her issues, she had been on testosterone. She had, her voice is permanently masculinized. And when she would go to the doctors, whenever she would talk about, having been on testosterone for gender reasons and then detransitioning, the doctors were far more hesitant to speak negatively about the testosterone use were, way more just, she felt almost like a hostility over the fact that she was a detransitioner. However, she decided to then change what she said to them, and she told them that she had abused anabolic steroids, which is the same thing, right? That she used to be a bodybuilder and she chose to abuse anabolic steroids, and she said then and only then was she getting an honest appraisal about the damage that she had probably done to her body, and an honest appraisal of the danger of that sort of drug use. But when she framed it as though it was gender medicine and she was using the drugs for gender purposes, they were very hesitant to outline all of the damage, all of the danger. That's why it's really important to look at every use, all of the reported side effects in the different populations and for different uses, because we might be getting a very different look at the same exact chemical compound.
The problem is when you don't have testosterone, you lose muscle quickly. Some men will lose up to 30 or 40% of their muscle, and this translates into notable fatigue. Men just start to feel old.
So muscle loss is a side effect of Lupron. When we think of muscles, we think of, muscular skeletal muscles. We're thinking of, the larger muscles. We're thinking of, our pectorals, our biceps, the things that you work out in the gym. What people typically don't think of is the smooth muscle in your heart, right? They're not thinking of the coronal muscle that keeps your heart beating. They're not thinking of, the muscles in your, head, the muscles in your hand that deteriorate, right? They're not thinking of the muscles that help organ function. Okay, these other smaller muscles, again, that help, with digestion, that help, pass waste through our body. They're not thinking of even things like your tongue is a muscle. If your tongue starts to deteriorate, what kind of impact on your speech is that going to have? We're thinking about bone loss. You're not thinking about the inner ear loss. What about hearing loss? If children who are growing are going to experience mineral density loss and interference in osteoblast production, what about their inner ear? What if we're going to have children who are hard of hearing? As a daughter of a woman who had about 75% hearing loss, my mom was, nearly clinically deaf since she was a little girl, because they didn't have treatments for the sort of inner ear infections that she had as a kid, and has used hearing aids my entire life. I know how much that impacted her ability to learn. It impacted her ability to take in information. They didn't recognize her as having the disability that she really did have. How is that going to impact children's ability to socialize? If you can't really hear what somebody is saying all that well, and again, it's not necessarily a complete and profound loss, but maybe you can't hear certain syllables so well. Maybe the hearing is muffled. Maybe it just makes it difficult for you to really understand what somebody's saying, and then it's embarrassing to say, what? Sorry, can you repeat that again? I'm sorry, what'd you say, huh? And after a while, you just kind of smile and nod and you pretend like you know what's going on. Or if you're in school or in class and you've never been even diagnosed as having a hearing problem, and it's hard for you to even recognize the fact that you're missing things. There are so many levels and layers to this. You cannot disrupt an ecosystem like the human body that is so intricate and complex as it is, and not expect for there to be a cascade of negative side effects and consequences.
So whenever I start someone on hormonal blockade, I emphasize passionately that they must do weight training, preferably under the supervision of a trainer. This brings about accountability. It makes sure that people don't get injured. And of course, it helps ensure that they do the program.
Can you guys hear it okay? Can you hear the video okay? Just let me know in the chat if you can hear it well, or if I need to like adjust the microphone.
On hormonal blockade, you cannot take a holiday from doing weight training because the muscle mass loss is so brisk. You must sustain the activity. And if you're faithful and continue in that pattern, the problems that are so commonly associated, such as fatigue, are greatly reduced and sometimes eliminated altogether.
Okay, so he's saying because muscle loss is so brisk that you must maintain a pretty, what sounds like intense regimen, right? And these are kids, again, who are going to school all day, who are already exhausted. So you have a child who's already exhausted, who's mentally ill, possibly neurodivergent, autistic, you know, who maybe clearly has a lot of body dysmorphia, body image disorders, who probably doesn't want to go to a gym where everyone can watch them, and is 8 or 9 years old, 10 years old, 11 years old. And we're saying that oh, don't worry, there's no big deal. You just go and, you know, you're going to go on a really intense bodybuilding thing, but don't miss a day because it can all be undone.
The next aspect of hormonal blockade I want to cover has to do with weight gain. When men have low testosterone, their metabolic rate drops, and if they just eat the same diet that they've always eaten, they're going to start gaining weight, particularly around the middle.
So when you gain a lot of adipose tissue around your midsection, this is the most dangerous type of weight gain, and it results in visceral fat. Hold on for 1 second. It results in visceral fat, which is when fatty deposits develop around the organs, and this is dangerous. This has an evolutionary function because in times of severe stress, our bodies have evolved to, when we're very, very, very overly stressed out, to deposit fat around our organs to protect them. But it's not really a long-term, you know, thing, right? It's not long-term. It will impede the function and the functionality of our organs. So we're having young people with body image issues, and we're giving them drugs that basically will change the distribution of their fat, start storing fat around their belly and midsection. And again, as you know, you cannot eliminate fat cells. You know, you can only grow or shrink them. And that's during a time when fat cells are probably going to start to grow in that area. Meaning that anytime you gain weight, weight is going to settle in that area. It's dangerous physically. And I can't imagine it's going to have all that much of a positive effect on the self-esteem of these young children.
And this is a difficult problem to control if men just stay on the same diet. When men are starting on hormone blockade, I counsel them to consider cutting back on their caloric intake in preparation for the fact that their metabolic rate will be slower. The third point I want to cover, I already mentioned, and that is the loss of sex drive. When men lose testosterone, almost everybody loses their libido or their sex drive. This doesn't mean that they can't function sexually with normal vigor with things like Viagra and Cialis, but they don't have the usual interest or desire. It fortunately is reversible when the treatment is stopped. But
again, it's reversible. Sorry, my dog is like, oh, say hi. This is Max. It's reversible in adult men who are fully, genitally developed, right? Who have had full develop and functioning of their gonads and their sex hormones and things like that. What happens with children? What happens? What happens to them? Does it go back? Does it ever develop properly?
The loss of libido is dramatic and oftentimes complete. And so men have to prepare, and
dramatic and oftentimes a complete loss. And imagine the sort of impact that this has on socialization. Again, we got to remember sex is we have such a distorted, bizarre relationship with sex. It's like we have these hypersexual, promiscuous behaviors and weird tendencies, but then we act like it's, oh no, but sex is bad and wrong. It's so weird. Okay, sex is important. It's normal. It's the way that we act about it is not healthy. It's gotten really out of control, the way that we objectify each other. But really, healthy sexual relationships are possible, and they're important, and they're a part of an adult life, and children are not many adults, but they will one day become adults, and they're in the process of developing into adults, and it's our job to protect that development. And imagine the sort of, if you look at Jazz Jennings, he looks so disconnected from his own sexuality. It's like, okay, I guess I should go find a boyfriend now, huh, Grandma? They're like, oh, Jazz, have you had relations with a man yet? He's like, Grandma. And it's like, oh my God, like, it's so awkward. It's important to go through a process of becoming an adult, of relating to other people, of going through processes of a sexual awakening, of discovering yourself. And to take that offline from children before they've ever experienced it. We don't know what that's going to do long term. We don't know about the psychological ramifications. And again, sex hormones have a very important role on brain development. When you impede this process, you are impeding the brain and cerebral development of these children, which will have psychological impacts that have yet to be realized. We will find out, and I think tragically, exactly how bad and how far this has gone in several decades when we have not only physical ramifications that we're going to be swamped with, but also psychological ones, when these kids have not been allowed to develop properly mentally, psychologically, psychosocially. They're not developing, social, when you're not developing sexually and psychologically correctly, it's going to impact your ability to function socially, which is going to impact, these kids are going to get further and further behind. So much time is spent on recovery and doctor's appointments and getting procedures and trying out different regimens. Well, this one didn't work, so now we got to do this. Or, oh, this surgery got botched again, predictably, so now we need another surgery. All during a time when children are supposed to be developing relationships, developing friendships, developing academically, learning, learning critical scholastic skills that will carry them into their adult jobs and careers. Learning how to develop routines such as caring for themselves on the most basic level, how to make your bed, how to brush your teeth, how to maintain your hygiene, how to take care of friends, how to deal with loss, how to deal with, tumultuous friendships or the loss of friend groups, or how to meet new friends, how to enter into a newly romantic relationship at appropriate ages and appropriate stages. And we're just it's a cascade. It is impacting, literally it's going to impact kids academically, it's going to impact them socially, physically. Every single aspect of this child's life is going to be touched. And they have the audacity to say that puberty blockers are reversible. Come on. And God forbid, they keep going, taking the next step. Because again, it's a big leap to go from nothing to all of a sudden, having sex reassignment surgery, but it's not a big step when you're taking all these little steps along the way and just taking one more and one more. You're going to get to a point where it's only one more step to take across sex hormones. And we know that Lupron followed by cross-sex hormones results in sterility 100% of the time. These young kids are going to have to make decisions about their fertility decisions at the age of 8 and 9. And the most vocal of these, trans healthcare proponents are people who are never pubertally suppressed, who are fully sexually functional, who were allowed to develop, gonadally, who were allowed to develop genitally, who've had an orgasm, who have had sexual relationships, who've had romantic relationships, whose bodies, and those are the ones, because they're imagining, what could have my life have been like if they really believe that it's sort of like this Peter Pan pill that will keep them, young and special and whatever forever. And they don't, it's so aggravating. Anyway, let's see what else this clown has to say. Sorry, he's not a clown. He has nothing to do with gender stuff.
Significant others need to be prepared for a radical change in interest levels while the treatment is ongoing. As of right now, we don't have any interventions to correct this other than to simply stop treatment. Next, I'd like to cover some of the other metabolic effects of low testosterone levels. One is the possibility of breast enlargement. Breast enlargement, called gynecomastia, occurs in maybe a third to a half of men if they take Casodex alone, a pill type of hormone blockade, and maybe 25-30% of men when they're on Lupron. The breast enlargement is irreversible, and if
so here, let's hold on.
A man wants to try and treat that problem, he has to have plastic surgery.
Okay, so this is now the second time that someone has admitted that there are irreversible impacts of Lupron. And in this case, it's gynecomastia, which is when males develop breast enlargement, which, also puts them at risk of breast cancer. Follow that with estrogens, and they're definitely at risk of breast cancer. And follow that with the fact that there are a lot of men who are obtaining cross-sex hormones from illicit sources online from China. They're ordering it online and they're self-administering it. And because a lot of them are, mentally ill and don't have any sort of medical training and are really, really just desperate for a quick fix, when they don't have the immediate results that they think they should be having, what do you think they're probably doing? Yeah, that's right. They're probably just jacking up the dose, thinking, let me just double it and maybe my boobs will grow bigger or faster. Not realizing the cancer risk that puts you in. You can't be on hormones for much longer than a decade before you start to have serious side effects. This is why early menopause in young women is so serious. Because we can remedy some of the problems that come with menopause with exogenous hormones. Not all of them, I can assure you, but some of them. But we can't be on it forever. So if you're putting girls in early menopause at the age of 20, they might be able to take, exogenous estrogens till they're about 30. And then what? They have the gonadal functioning of a 60-year-old at the age of 30. They're developing plaques on their brains, which leads to early dementia. They have, no self-lubrication. Their sex drive is plummeting. They're facing vaginal stenosis. Facial hair develops. Body fat redistribution. We're just doing... just that's what they wanted. That's what they want. Like, what are we doing? Max, I'm sorry. He's like snorkeling. He breathes so loud. Max, come on. You can't be in here because you're breathing too loud. I love you. You can't be in here. Go play with Zeke cat. Go play with the kitty cat. Don't go in that room. I love you. You can't be in here because you're breathing too loud. Sorry. He's like a little snorkel pig. Okay.
So the point of this is to prevent its development in the first place. There are two potential ways to accomplish that. One is to take a estrogen blocking pill, originally FDA approved for the treatment of breast cancer, called Femara.
Okay, well, obviously, if in the case of gender medicine, if the desire is for, breast development, then they're obviously not, that's what they're going to want to do. They're going to want to take estrogen, right? And all of our bodies produce cross-sex hormones in small amounts. So men are producing estrogens, right? So even without the complement of cross-sex hormones, men still have estrogens and they are still going to be developing breast tissue. So for, young boys who decide that they don't want to go forward with the exogenous, cross-sex hormones, and they don't actually want to transition, and they want to be their, real sex, and they're just continue on as their natal gender and their natal sex, well, they could have had gynecomastia, and then what? They're saying that the only remedy at that point is plastic surgery. But it's reversible, right? I gotta go in a minute. So this is just gonna be part one. I'm gonna keep looking at Lupron, but I want to take a look at just somebody here. Hold on. Trans kids puberty blockers. Alrighty. Let's see, Healthline. God, these people are sick. Okay, so let's see. This is the NHS. All right, so this is from the NHS, National Health Service. Let's see. God. Where's the video? I want the video. Let's see. Dun, 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 dun. Hold on. God, where's that one guy? Hold on. Seattle Children's. Okay. All right, let's see what Seattle Children's Hospital has to say about it. Gender clinic. Let's see. Puberty blockers. Okay. Oops.
Puberty blockers. What are puberty blockers? Puberty blockers cause your body to stop making puberty hormones. This is like hitting the pause button on puberty. It can prevent some of the changes to your body that do not match your gender identity and can give you time to explore what you feel comfortable with now and in the future. Like other medical treatments, there are benefits and risks. What is puberty? Puberty is the process your body goes through to become capable of making a baby, as well as reaching adult size and adult brain development. This happens at different ages for different people. What are the body changes in people with testicles? Without puberty blockers, these are the changes that happen during puberty: testicle and penis growth, facial hair, increased acne, growth spurts, voice gets deeper. What are the body changes in people with ovaries? Breast change.
People with ovaries. Don't reduce. It's so funny for a group that always says things like, "Oh, these TERFs are obsessed with the genitals of children." You're literally defining children by their genitals. People with ovaries. That's how we can now define people. It's almost as if there's markers for sex dimorphism. It's almost as if there's visual and physical characteristics that show that we're sexually dimorphic. It's almost as if, if only there was a good set of words for that, man. If only we had some words that could differentiate between people with ovaries and people with testicles. Jeez, you'd think that they would have thought of that when they were developing the English language. Well, maybe one day we'll have one. Oops, I'm trying to press the play on there.
Changes in body shape, including fuller hips. Menstrual periods start, usually more than 2 years after breast change.
How far did you guys see? It just said that it was disconnected. Sorry, let me start this again.
Bodies with ovaries have started to have breast changes, size, and growth of the... This is after bodies with testicles have started to have puberty blockers after your body shows signs of puberty. Usually, this is after bodies with testicles have started to have increased testicle size and growth of the penis, and bodies with ovaries have started to have breast changes. It is not necessary to start puberty blockers before puberty. What if puberty has been happening for a while? Puberty gradually changes the body over 2 to 5 years. If you start puberty blockers after puberty has been happening for a while, they can prevent any further changes, but they cannot reverse the changes that have already happened. The earlier in puberty the blockers are started, the more changes to the body they can prevent. For example, if started early in puberty, puberty blockers may reduce the need for future surgeries or other treatments. That is, breast removal, or mastectomies, for transgender men, or hair removal for transgender women. Because puberty gradually changes the body, for some people, puberty blockers may block future body changes, even if you are in the middle.
Helena Blavatsky says, and puberty isn't a health problem. Absolutely. Puberty is not a disease, and it's being treated as though it's a disease. There are even advocates that say every child should be put on puberty blockers, the same way that the whole they be trend, where people were refusing to disclose whether or not their child was a boy or a girl because they said they wanted to give the child time to decide their gender identity, and then they have this big weird gender reveal when the kid is 10. So those are the sort of people who are saying that every child should be put on puberty blockers so that later they can just decide, well, what do they want to be, huh?
Of puberty. Are puberty blockers permanent? No. If you
Are puberty blockers permanent? This is from, as you can see, an accredited hospital, Seattle Children's Hospital, Gender Clinic. Are puberty blockers permanent? And they say no. No, no, no. This is what children and their parents are receiving medical advice from when they're online searching for information and they're watching this video. They see some disembodied hand write the word no after asked question if puberty blockers are permanent. Well, what about the two clear examples? What about the two clear examples that showed us of when Lupron is absolutely not reversible? Examples that the makers of Lupron themselves acknowledged and even put on the label. We've known for years that this has irreversible impacts. We've known this for years. Why are these people not being sued for medical misinformation? Why did they get to have the accredited hospital little symbol? We know that this is false. We know that this is false.
If you stop taking puberty blockers, your body will continue going through puberty. How long do they take to start working? It can take 1 to 2 months for the body to stop making puberty hormones. hormones. Everyone's body responds a little differently. How do I take the medicine?
Do you hear the sort of like underlying, I gotta go actually right now, the little underlying like anxiety, the little push for starting early? Can I start puberty blockers at any time during my puberty? Yes, if your body has already gone into puberty, changes might have begun, but unfortunately changes that have already happened are not reversible. However, if you start puberty blockers earlier, then they can prevent puberty from happening. And parents are sitting there watching the part where they say, and it can prevent future surgeries from being necessary. And parents are probably thinking, oh, well, that's one good way to, risk management, to sort of minimize the level of risk and the level of exposure to surgeries and medicalization. I guess, hey, puberty blockers doesn't sound like such a bad idea. And, the way he describes it is just a little pause button. Oh, that doesn't sound so bad after all. Gerald, here at Seattle Children's, they're saying it's just like a pause button, Gerald. Little Tanya says that she's a Tom. Why don't we just let her try it out for a little bit? And he's like, well, Sonia, that might not be a bad idea. And everyone's like, well, let's give him a call. Well, you know what? I think it's really important that we send little Tanya. Well, I guess we should call her Tom now because, he, him. Why don't we go check out the gender clinic? I think it's important that we send them to a therapist first. Well, let's give them a call. And who's going to be reaffirming all of this? And we're going to talk about why. I got to get going. But the fact of the matter is, this is not unknown in the big pharma. We know that Lupron has had the largest payout in American history for a medical scandal, and they had a judgment against them, a civil lawsuit against them, and they had to give out tons of money. We know that it costs a lot of money to develop drugs. A lot of times drugs to enter into new markets will try to come up with off-label uses for the drugs to expand their use and to expand the income. We know this, it was like with Motrin, right? Motrin suddenly marketed it. Motrin's like ibuprofen or acetaminophen or whatever. It marketed itself as being for like period cramps, but it's literally the same exact thing as like Advil. Okay? It tries to rebrand itself. And they lost a ton of money. So is it any question as to why they're trying to rebrand themselves now, as they went from being, first they started off as a men's prostate cancer drug, but that's prostate cancer, a lot of men do get prostate cancer, but that's still a fairly smaller group of people, right? Well then we thought, endometriosis, but still only something like 1% to 2% of women deal with endometriosis. Well what about, we got precocious puberty. Okay, well, that's also really rare. Precocious puberty, it's getting more common, but it's still fairly rare. Got it. We can make it where it's like a non-measurable, non-definable disease, where there's really no way to prove that the person has it or doesn't, and it's, spread by social contagion, and we could get them early, and they're going to need it for a long time. I got it, by golly. We got ourselves a whole new demographic of people, a whole new market open wide up. Is it any question why they're evolving to make the money off of a new entire market of people? Is it any question at all? No, it's obvious. It's obvious. And they're signing these kids up. They're shipping them right over. And we know what this thing can do. What we don't know, we know what it can do to fully formed adult bodies who have, a much more of a difficult, risk-benefit analysis to deal with, who are dealing with cancer that could potentially be terminal. But what we don't know is what it does to bodies that haven't even had the chance to fully form. We're going to find out, and it's going to be catastrophic, I can assure you. Stay tuned for episode 2. I got to get going. I love you guys. Thank you for being with me. If you can, support the channel. My Cash App is a slightly twisted XX. $ a slightly twisted XX. Thank you so much for anybody who has already donated, supported the channel. It helps me so that I can keep making content. I was recently demonetized, so I can't make money through YouTube anymore, which really sucks. But if you guys do want to continue to support me, it like really helps my life. And I love you guys. And yeah, we are hopefully going to be planning some more speakers corners in Philly soon, so I'll keep you guys updated on that. And if anyone needs to get in touch with me, slightlytwistedfemale@gmail.com. Oh, and stay tuned. I'm going to be on Benjamin Boyce for an interview coming up on Sunday. So check out Benjamin Boyce's channel on Sunday. I'm really excited. And I'll see you guys later. Bye-bye.